I'm going to introduce the next speaker, Matt Landowski. I told him to write a couple things about himself, and he's like, I'm a humble guy. I'm not sure I can do that. But he wrote one thing that I thought was awesome. So I'll see if you guys can pick it out. Principal data scientist at Aspen Insights. First data scientist at Lockheed Martin. Nice. Background in semiconductor design and research. So give it up for the first data scientist at Lockheed Martin.
Hi everyone. So who here has heard of artificial intelligence? I'm assuming that most of you have. Raise your hands if you haven't. You're probably stuffing your face. That's okay. So what I'm going to do is talk about artificial intelligence, what that means within our company, and kind of level set those terms and keywords for the rest of the talk. So when I was 5, artificial intelligence was kind of something scary, something that looked like this, right? Some glowy red eyes, kind of complex, kind of smarter than me and stronger. If this doesn't resonate with you, maybe you remember, HAL 9000, right? So something built with the greatest intentions, complex, but at the end of the day, kind of unpredictable, right? Something you can't really control. What you might not consider artificial intelligence is something that you have on your phone or your TVs or your computers. That'd be like something like Netflix or my Disney Plus account. Screenshot right here. So you can see I might be a Star Wars fan right there. But what's kind of interesting about this is that they've taken this the data from everyone that's been watching movies on Disney Plus or Netflix, right? And based on what those people have watched, what overlaps with what I've watched, they suggest movies that I should watch, right? Or even beyond that, they look at the movie itself, say it has lots of explosions or lightsabers, and they know, okay, this movie has similar visuals or audio or like a script. Well, then it might suggest that movie to me as well. It doesn't have to be just what other people have watched. Another place you see this now is hardware, right? You have the Apple Watches with the AFib ACGs on them. You have TVs with machine learning built into them. So there's LG TVs out there now with machine learning algorithms to like denoise the image, help enhance the image clarity. We have this LG TV in our office, and it has a AI tuning function. It's in the menu. It says AI tuning function. What you do is you take the remote, and it has a little microphone in it. You sit in like your preferred sitting location at your house or your office, and then you go into the menu. You hit Tune AI Audio, and then it goes out and kind of sends some pings that you can't really hear, and just tunes the audio, enhances it, gets rid of kind of vibrations and stuff in the TV, and maybe it's in an enclosure, gets kind of rid of all those vibrations and things. The audio distortions kind of go away. But it'll do it for your preferred sitting location. So that's just kind of the machine learning in our daily lives that we might not notice. So what I'm going to go through next is kind of like the landscape of AI, right? So there's AI, machine learning, deep learning. How does it all work together? How does it all kind of layer on top of each other? There's a really good book that I think kind of helps decipher this for us. It's called Deep Learning by Ian Goodfellow, Yoshua Bengio, and Aaron Corville. And so I'll just kind of walk us through it and kind of help set the landscape for us all. So at the biggest level, artificial intelligence is intelligent software, right? So it's something that helps us complete one or more tasks. Could just be like a simple keyword search on something. That would be intelligent software. Help us find information kind of as quickly as possible or do something useful for us. So once we get beyond that, we get this machine learning. This is where everything's kind of happening right now due to excessive compute that we have available now and all sort of other things. But the machine learning is good because you take data, you take labels or targets for that data, and then you create these machine learning algorithms that will help you do predictions on new data that it has never seen before. So a good example of this is like loan origination, right? So most of if you buy a new car, you've probably your credit history and everything's been through a machine learning model to predict your default rate on that loan, right? And then based on that, they gave you some percentage APR on that loan. So that's an example of that. So beyond that, representation learning. So if we don't have targets or labels, we use something called representation learning, where we just extract features from data. higher level, more complex features than what we start with. So say we have some text, like 500 words, and we run that through some representation learning algorithms, and we end up like with 10 numbers, right? So we reduce that size, and then we feed those 10 numbers through some machine learning algorithm, and it'll operate faster and give us those models we were talking about sooner. So beyond that, we get to deep learning. So deep learning is representation learning kind of taken to the next level. So you have multiple layers of this representation learning on top of each other. You take, every level captures a more complex feature. So, a good example of this is, say we want to classify, an elephant versus a human, right? So we look at an image and we want to know if it's a human or an elephant. So it looks at the image, it sees 4 legs, but maybe the human's on all 4s or something, right? So it can't discern just from the legs whether it's an elephant or a human. So it has to go to some other, the higher level of representation and look at something like maybe ear size, right? So if we're looking at the image head on, maybe the image has very large ears, that would maybe signify elephant versus a human. So it'll pick, the elephant if it saw those large ears. That's kind of the big high-level kind of landscape of artificial intelligence, kind of what that means within our company. So the previous paradigm, before machine learning and all that, would kind of look like this. So you had observations, you had rules, and these rules were generated by basically 5 people in a room, right? Came up with these rules, and they had some programmer or something, or business logic tool that they input these rules into. It would go through the computer, and then you get some answers out, right? That's kind of the previous kind of traditional model. With machine learning and artificial intelligence, it kind of flips this around a little bit. So you have observations, you have answers, and then you send those into these machine learning algorithms, put them into the computer, and then you get rules out, right? So these rules are generated by these algorithms, and they can be as complex as that machine learning algorithm can handle. And they'll be more complex than anything that 5 people in a boardroom or 100 people in a boardroom could possibly come up with. So how is AI being applied? There's kind of 2 main approaches. One is, I call it like the Google approach, the give me the answer approach, right? So this is like the ultimate search engine. You open up Google, you type in like a question, and it just gives you the answer, right? I mean, that's Google's goal. Like, never have to click on anything, never have to scroll to the next page or drill into anything, just give me the answer. So a good example of this is, say I want to know, I'm an astronomer, I want to know the distance from the sun to Mars. Well, I just ask Google, right? It just tells me the answer, 144.91 million miles, right? Didn't have to dig into Wikipedia or anything else. Maybe I want to know, this is kind of how like Alexas and the Google Homes work as well. But maybe I want to know what that is in AU, which is like the speed of light, the distance and the speed of light, right? And I just ask for it in different units, right? And it does it. So that's pretty cool. And it just reads the text, knows what I want, and then also knows what units I want it in, and it just gives me the answer. So the other approach is kind of Aspen's approach, and I'd say Microsoft's approach to this, and it's help me get the answer, right? To sprinkle artificial intelligence and machine learning in the products to just help you use that product more effectively or do your work faster. My favorite example of this is the new Office 360 PowerPoint. It has a design ideas tab, so I put in a list, maximize profit, minimize loss, excite customers. I open up this design ideas view, and it has some suggested, recommended slides. And then I pick one, and it automatically generates these icons. It doesn't draw them, but picks them out of a curated list, right? But it rearranges the text, puts the icon with the appropriate text, and you can see it did a pretty good job, right? For maximize profit, picked a little icon with an increasing trend. For minimize loss, picked an icon with a decreasing trend. And excite customers, put a bunch of hands together. And I'd argue with, like, if you've ever played team sports, I think it even caught the excite word in there, where everybody puts their hands together. They cheer for the team. So I think that's pretty neat. So the next thing I'm going to do is kind of talk about kind of where we see artificial intelligence and machine learning being applied in healthcare. So a couple places. The first one, pathology. So microscope slides, imaging. looking at slides, detecting viruses or bacteria, and then even classifying what those are. And also radiology, so MRIs, X-rays, looking for dense cancerous tissue is a place we see this being used. Clinical operations, so helping doctors and patients and nurses do work more effectively, getting rid of low-value tasks. So there's a company out there that has they put a microphone like in the room with the doctor and the patient. It transcribes the text that they hear the doctor talking about with the patient, and then it automatically puts that stuff into the EMR without having to have someone type it in, do data entry to do that task. The other place we see this is the treatment recommendations. So based on, if they're seeing a lot of patients, might not be able to comb through all their history or previous patients that had similar symptoms and medical history. So we can look at, leverage these machine learning algorithms that can look at all that information at once and then help, suggest or recommend possible treatments based on historical data. So there's lots of machine learning opportunities available out here. A lot of it is a kind of free-form text-based, so freehand text at the EMR, where doctors have just put information in various locations. There's like PDFs and images that we can use to extract other text and information that's been added there that is highly valuable, but just kind of hard to get to. Doctor notes, I kind of mentioned that a little bit earlier, but doctor notes that are just maybe put in the EMR in locations where it wasn't really meant to be, but it's still good to capture that. You have annotations, so say we had a radiology or x-ray slide and then some doctor wrote some notes or circled some things. I mean, that's information we want to capture as well. And then just documents that come back and forth, just maybe not from that EMR, but maybe from a lab comes in or from other location or another EMR. So there's lots of opportunities out there, and this is all kind of examples of digital exhaust, and that is what Walter Storm is going to talk more about and how we're leveraging that at Aspen Insights. Walter Storm is a former Lockheed Martin LM Fellow before taking on this adventure. He's our CEO of Aspen Insights, and without further ado, Walter Storm.
So, I think I'm number 3 here. You guys hear me okay? All right. So I grew up in this this weird kind of era. It's called a microgeneration. So it's very interesting. I just kind of read up on this. There's this little tiny window from 1977 to 1979 where these people that were born in that little tiny window have 1 foot in the analog world and 1 foot in the digital world. So I've used a rotary telephone. I know what it's like to see the little lines come on the TV at night after 11 o'clock when it goes off the air, right? I had the Atari that I had to plug into the antenna input, to get to work on a black and white TV. But at the same time, I had an asynchronous transfer network and like a T1 line in my college dorm room, right? Like coming of age and like having this kind of technology. And it was really cool. I mean, it was interesting because it gave me some interesting perspective on how do people view technology and the advancements in this stuff from a generation ago and where are things today. And what really struck me super hard was a couple years ago, I have 3 kids, so 16, 14, and 8. But when the youngest one, Leo, was about 3.5, 4 years old, he was at the house, and he was sitting on the steps, and he was watching his Kindle. He was sitting down on the stairs, and then all of a sudden, he starts crying. And I'm in the kitchen wondering what the heck is going on. And so I go over to him, I'm like, dude, what's up? What are you doing? And he looks up at me. And here he was watching Teenage Mutant Ninja Turtles, and it went out on his Kindle. It was gone. And he looks up, and he says to me, he's crying. He says, "This isn't even a real house anymore, And I'm thinking, not a real house anymore. Like, what is he saying? Like to him, being connected, like he didn't know any different. Might as well be like we might as well live in a tent. You know, I mean, it's like, this isn't even a house, right? And so it really got me thinking. It's like, this is crazy. People are really expecting to be plugged in, right? And so we kind of go through this whole idea of Industry 4.0, right? The rise of sentient tools, the rise of artificial intelligence, and the ability to enhance human performance, right? And we do that through a number of ways that are very subtle, like Matt showed in his examples. And it's like another interesting example. So the four of us went at Aspen, we went to yoga the other day, right? And so we make sure we have strong body, strong mind, so that we could disrupt clinical trials here. And so in this adventure, the four of us kind of drive downtown, go do our yoga thing. Well, Matt was driving, and he had to go back home to do something with his AC or whatever. So the three of us that were left were kind of stranded downtown. And so we went over and we had some lunch across the street. About 15 minutes later or so, I get this ping on my phone from Lyft. It's like, oh, 10% off, your next Lyft ride. I'm thinking, okay, that's a little, it's a little creepy a bit, right? So like, what happened there? What happened in that scenario? And so what they did was they actually used something that I call digital exhaust. So, Matt, before I get to that, so Matt kind of alluded to it a second ago. So every single thing that we did in that adventure generated a piece of exhaust. So it saw that 3 phones were together, they got into a car, that car went somewhere, 1 left, 3 were back, they went to this restaurant that takes roughly 15, 20 minutes to eat at. Oh, what's the most convenient time to think, to send the message to give you, an opportunity to get a discount on your Lyft, right? And so this is how this stuff is creeping into our lives, and we don't even often realize it, right? And so the entire medical record and everything, when we came from Lockheed Martin, we were doing this in different domains where, looking at air, land, sea, space, cyber, where people generate a whole bunch of digital exhaust that we could fuse together to create some insights around patterns of life and how people do things and where threats might arise. And it's like the same thing exists in the medical field, just in a slightly different way, a slightly different construct. We have systems where people put information through these medical records in order to either be compliant or get paid. They're not necessarily there to generate continuity of care and those sorts of things, even though that's a nice to have. But it does generate a bunch of exhaust, things like patient encounters, medications, illnesses, all of this stuff that you see, social history and family history in bits and pieces, are somewhere scattered about, either on a PDF or somewhere in the electronic health record or somewhere in a doctor's note or something like that. And so that could provide some really useful things. So those electronic health records from the physicians, as well as laboratory information systems. So we're partnered with Arbor Diagnostics, which is a wet lab that has pretty much every specialty for women's health, all under one roof. And so that allows us to get actual machine level data along with all of this rich text and all these images and PDFs and those sorts of things. And not only that, but now we also have another set of digital exhaust from the medical community, right? So we have a bunch of technologists and aerospace and defense people getting into healthcare. We don't know what these terms are. We can't pronounce half the words half the time, right? But fortunately, there's a huge corpus of medical ontologies and structure and research that's been done over the years that we could leverage, right? So we leverage that as well. We leverage the best of both humans and machines. That's really the goal. Make the machines do what they're really good at. Let the humans do what they're really good at. Identify patterns and do higher level abstract thought and reasoning. So how do we refine this stuff? So I'm not going to go through all these in too much detail, but I want you to think about this digital exhaust just like you would think about regular exhaust from your car, right? How do you go and capture carbon out of exhaust? How do you take all of this stuff from things that are left behind and actually refine it and create something valuable? And it's very similar to like even oil, right? So if you think about data as the new oil, I don't know if you've heard those terms from some of these conferences or Gartner things or whatever, right? Sometimes we like to think data is nuclear fuel because you actually have to be careful how you handle it and dispose of it too, right? But it's a different analogy. But the data in its raw form isn't always that valuable. And so we have to do a lot of data engineering. We have to do a lot of manual stuff to take those images and words and turn them into real text through optical character recognition. We have to take all that stuff and figure out the language model, right? The fact that I could think a thought and articulate my voice and send that thought through the air, through these vibrating waves, you interpret it and actually have a thought yourself. What that's doing is that means that, hey, there's some inherent information in those utterances that are coming across these sound waves, right? And so what these computers do is actually take that and represent those words as a bunch of numbers, right? It's the fact that there's some information embedded in that structure that we could actually generate some useful stuff out of it. We'll show you what that looks like. So once we have that, that's a huge dimensional space. We reduce it using things like manifold learning. We'll walk through an example like that. And then the ontology fusion is really that benefit, taking the stuff that the humans are good at, where we have the medical corpus, all of that stuff, and putting it all together. So what does it look like? What do our algorithms see? How could I take a lot of these words that seem very abstract, especially for people not necessarily doing this every day, and turn it into something that is tangible, and not just tangible and interesting, but how do we get from interesting to useful, and how do we get from useful to really, really valuable? Right? So that's kind of the quick walk. It's like, wow, this is cool. So what? Okay, this is interesting. Now what? And now it's like, oh, there's real value creation here, right? This isn't financial engineering. We're not doing any sort of, service arbitrage. This is raw value creation. So what do our algorithms see? If you look at this chart here, it's not quite as clear on the screen here, but you go on our website and see it. This is a graph. Each dot represents either a clinical trial, a patient, a concept, a disease, a drug, an indication, some sort of thing. So lots of different colors of dots. All of them are connected into this giant mesh of graph. And so if you think of all of this stuff as like a universe of things, think of this as a bunch of stars in a universe, and things that are similar are going to start to attract closer together. Things that are less similar are going to start to repel each other. You're going to end up with this emergent network, this emergent behavior of a system that is really interesting to look at, and it's really what's kind of underneath the hood in a lot of these algorithms, but it's still not useful yet. How do we get a little bit more useful? We take that high dimensional space, and the idea here is to figure out how could we every night match 500,000 patients to 25,000 actively recruiting trials every single night, right? How do we do something like that? We have to reduce the dimensionality of the problem. We have to take that huge dimensional space, project it down in a way that maintains both the global and local structure of the data, and we do that through that thing that we call manifold learning. And so what you see on this screen are a bunch of clinical trials. Each dot's a clinical trial. And it's a clinical trial that matches at least 10 or more of our patients in our patient population. And you're going to see there's a bunch of stuff in this chart that we're going to break down. So we take that high dimensional feature space that a human, it's interesting to look at, but still can't really read. We project it down into 2 dimensions. Okay, now this projection, the information is still there. It's just a way to see it now. And so we have a bunch of words that show up that represent in a one-word way what those clinical trials are really all about. What's interesting behind this chart is that none of those labels were human generated. Like the machine, this is in machine learning terms, this is a 100% unsupervised process where, based on where these things landed in this high dimensional feature space, we basically found the centroid of that cluster and found the word that mapped closest to that centroid, right? And so that's just machine learning speak to say, hey, these words are very high information value words, which is really interesting and clever, but they also represent something neat, because if you look here in the upper right, we have words like tremor, epilepsy, aphasia, reality, sleepiness, things that have to deal with like mental stuff. Up here is like depression, and PTSD is way up there on the ceiling. But over here, you have like endometriosis, pain, fibromyalgia is somewhere over here. So a lot of things that have to do with pain. And if you look at right here, headache, if you think about it, is pain in the brain, right? So you're starting to reduce this dimensionality. You're starting to be able to say, oh, I could get a little bit of insight from this, and I could see some things that are going on in a way that the machine sees it, not a human. Over here we have what we call the island of the eyes. So you have macular degeneration, cataracts, those sorts of things. So again, this is interesting, this is cool, and we're like, wow, this is neat. Here we are, a bunch of, aerospace and defense dudes, and we're like, we know all this stuff about medicine now, right? And it was just totally uncovered. We found this interesting link between hearing loss and osteoporosis. And we're like, oh man, if you have osteoporosis, does that lead to hearing loss? So we Googled it up, and it was like 5 years ago, this research was done. There's this huge link between osteoporosis and hearing loss. We're like, we can be researchers, right? It's like, this is cool. So it's cool, it's useful, but so what? It's like, we're like, so what? How do we get to the next level? How do we make this valuable? So, all right. So cool, okay, before we get to valuable, let's make it useful, right? So it was cool, the map was cool, the exploratory stuff is cool. How do we make cool useful? Well, we actually have to take that stuff and map it into real text. So what you see here is some text from a clinical trial. So and if you come by our demo booth or whatever, we could put some text in there or whatever and demo this live for you. But what we do is we actually go through, put this text in here, and start the process, start annotating this stuff. So we run our annotation engine, which is a pretty powerful annotation engine, really proud of that. We annotate roughly 20,000 words a second compared to something like BioPortal, which is like 10 or 20, if that, words a second. So, we have a pretty powerful annotation engine to really process a lot of this text, a lot of machine learning algorithms underneath the hood to do named entity recognition, all this sort of stuff. It's pretty cool. So the cool to useful bridge is right here. So now that we could annotate things and we know what they are, we know whether it's a diagnostic procedure, a disease or syndrome, a sign or symptom or whatever, now we could provide some sort of interface to the human to help guide this stuff along. Right? How important is this term relative to everything else? How important is this to that? What sorts of things do we want to start matching patients on? So we go through, and this is where we elevate the human to that superhuman level. And so now this is where it starts to get pretty valuable, because now we're able to find this needle in a haystack, right? We're able to traverse this deep clinical record across all kinds of things. What's interesting with this example that I showed here, this is an endometriosis study. This little section in the clinical record is this documented conditions. This comes from like the billing, the ICD-10 codes or whatever. What's interesting is this patient was never had anything billed for endometriosis, right? But there's some stuff in this clinical record around this, don't make me pronounce the word, dysmenorrhea. There we go. So dysmenorrhea, endometriosis. I'm doing good, aren't I? But anyway, these terms are here, and one of the criteria was, hey, it had to be identified by laparoscopy, and so we have some laparoscopy, and we have all this stuff that was in different areas of the clinical record in raw notes that weren't, any sort of structured stuff at all, and we were able to identify this needle in a haystack and find what we think is going to be a really good match. And so that's great. It's cool now. It's interesting now. It's kind of valuable. But still, it's like, how do we get to the next step? How do we monetize this insight? And this is where Cedar Health Research comes in, because what we do is we pass out and we do a full end-to-end solution with this technology. We don't just stop and give someone a list and say, here you go. We don't just do some sort of feasibility study with a bunch of de-identified patients. We actually have relationships with our physicians, which you'll hear from Dr. Richards later, where we could actually on their behalf re-identify these patients and hand them off to the professionals at Cedar Health Research who have more than 25 years of experience in running clinical trials and actually know what they're doing in this space. And we bring these experts on to actually execute the trial at a level that really couldn't be done before. And as you'll see, not only can we execute that trial, but take the results of the trial and the data from that trial, feed it back in our algorithms to refine it for the next time.